Hi everyone, thank you for joining us. We're just going to wait a few more minutes to see if we get a few more participants to log in. Hi everyone, we want to thank all of you for joining us today for Illinois Action for Children's Public Policy webinar on state and federal updates. My name is Mercedes and along with Maria we'll be conducting this webinar. So all of you should currently be on mute, and if you would like to ask a question, there's actually a chat box where you can do so, and we'll reserve some time at the end for questions. So to start off, I'm going to turn it over to Maria.
Hi everyone, this is Maria Esplin, Policy Associate here at Illinois Action for Children. Today for the webinar, our agenda kind of looks like a state update first. We're going to go over the session updates, the status of our legislation as well as the budget and what to expect in the final weeks of session. And then we're going to turn it over back to Mercedes, and she's going to talk about some federal things, including the budget and the American Health Care Act and the status of that and what else to expect in the coming months. So we're going to get started with our state updates, and as we do that, I just first want to remind you all of our policy priorities for the year. So earlier this year, we outlined a pretty lofty agenda to address a range of issues, including passing a budget for both fiscal year 2017 and 2018, as well as restoring access to CCAP for those who were left out after we got the partial restoration. So there's a few populations that are still without CCAP, so restoration of that was one of our main priorities, and as well as preventing expulsions in early childhood settings and supporting early childhood and K-12 partnerships. Spring into action, we focused a lot on that, and we have some exciting legislation around that as well. And maintaining investments in school readiness initiatives. We have been dedicated to advancing these priorities through drafting and negotiating legislation. We've been involved in many discussions around all of these issues, and we've met with a lot of providers and a lot of people out in the field to talk about how best to implement this legislation. And we've collaborated a lot with other advocacy partners. Just last week with our Advocacy Day in partnership with the Ounce Prevention Fund, we got to engage a lot of members in talking to their legislators about these legislative initiatives. So going on, we're going to talk about the status of all of these priorities and where they stand now. Sorry, next slide, please. There we go. All right, so first up we have House Bill 3213, which is Representative Wallace and Senator Hutchinson. And this bill restores CCAP to parents enrolled in non-TANF education and training programs. It does so by adding them to the priority populations for eligibility. And this is really important because if ever in the future CCAP is restricted as it was in 2015 to priority populations, these populations would, or this population would still be protected and included in CCAP. We estimate this would restore eligibility for at least 2,700 families and 4,000 children. So the status of this bill is that it's passed out of the House and it has passed Senate Human Services Committee. All that's left to do is pass the Senate and then it goes to the governor to be signed into law. Next slide, please. There we go. And then Senate Bill 1705, which is the same sponsors, Senator Hutchinson and Representative Wallace. It's identical to House Bill 3213. We just introduced identical language in both chambers. And you can see this picture here. Our Samir Tana testifying with Senator Hutchinson, who has been a great champion to restore CCAP. And the status of this bill is actually in the next slide. You can see here that it passed out of the Senate with strong bipartisan support on the floor, but we may not be moving it because House Bill 3213 has already made progress in the Senate. And remember, those are identical. So as long as we make sure that senators understand that they're identical, we should have just as much support when we take House Bill 3213 for a full floor vote as well. And so the next initiative is House Bill 2663, and this is sponsored by Representative Stratton and Senator Lightford. This is our pre-K expulsion bill, which ensures best practices in early childhood settings by prohibiting expulsions in licensed childcare and programs receiving funds from ISB. This legislation puts in place a process for providers, including documentation, attempting to access available resources, engaging families in intervention and transitions. We know that a lot of our providers are already doing a lot of these things to prevent expulsions, but it's just giving some more guidelines and calling for more documentation just in order to see really what steps are being taken before a child may be transitioned out of a program. And the bill also puts in place a system for data collection, which will help us understand the need for additional resources. And this bill has had strong bipartisan support, both in terms of who's sponsoring it, in committee votes and floor votes. And it has passed out of the House and out of Senate Education Committee, and now waits for a vote in the full Senate. And you can see here on this timeline, I did add that the rules adopted by DCFS is a huge piece of this timeline, because if House Bill 2663 is passed and signed into law, DCFS will set specific guidelines and implementation details for licensed child care facilities through the rulemaking process. So once this bill passes, it's not done, or once it's signed into law, it's not completely done. There still is the rulemaking process, and that is a participatory process where the public can provide comments for the department to consider while they make the rules. And our next initiative is House Joint Resolution 24, which is sponsored by Representative Willis and Senator Bettino-Tarrant. And it creates a Kindergarten Transition Advisory Committee. This committee will develop legislative framework to encourage alignment between early childhood and K through 12. So this, joint resolutions are not legally binding, but this one will set forward a committee to look at a way to make legislation that will be not prescriptive, but will outline some best practices for supporting transitions into kindergarten, such as shared professional development opportunities, data collection and data sharing, and family engagement, all things that we know help facilitate more successful transitions for children. And this has passed the House, and it's waiting in Senate Education Committee for a vote, which it's a little bit further behind than our other bills, but resolutions don't have the same types of deadlines, and they're a little bit easier to get through, so we're not worried about the status of that at all. So moving on from our initial priorities that we outlined at the beginning of the year into some additional early childhood legislation that has popped up throughout the course of the legislative session. First, we have House Bill 2426, which is sponsored by Representative Lynn Curry and Senator Aquino. And this cleans up CPS early childhood block grant statute to clarify that block grant requirements are aligned statewide. The Early Childhood Block Grant funds are used to supplement, not supplant, other funds already being used for early childhood programs, and the requirement for 25% of any new funds to be dedicated to birth to 3 programs, the responsibility of both CPS and ISB. This is really nothing new. It's just cleanup language because the statute was a little confusing. And so this has passed the House and Senate Education Committee and waits for a vote in the Senate. And again, it has been supported with bipartisan support. And House Bill 2388 is sponsored by Representative Moeller and Senator Castro. And this requires UCFS to add a field to their database on the Sunshine website just to indicate if a provider has had their license revoked or surrendered during a child abuse or neglect investigation in the past 5 years, or if a provider has been denied a license renewal within the past 5 years. The DCFS is working on their Sunshine website to make it, much more user-friendly, and so this just adds a field so that providers, or parents, have all the information when they are searching for a licensed provider. And this has passed the House and passed Senate Human Services Committee and waits for a vote in the full Senate. House Bill 3167 is sponsored by Representative Stratton and Senator Collins. And this requires IDHS to conduct a study to determine adequate compensation levels to attract, support, and retain quality early childhood workforce. And this report or this study would look more at what it really costs to provide quality care versus just what we are paying providers. This looks at really the cost of care to make sure that we set rates at an adequate amount or adequate rate. And so this has passed the House and Senate Human Services Committee. So moving on to the state budget update, and this, there wasn't really much to report until this week. They've had a lot of things kind of come up this week, so this is already going to be a little outdated, I'm sure, by tomorrow. But the state is approaching its 2-year mark without a state budget. Since we've been without a state budget, we've continued to pay for about 90% of services through continuing appropriations, court order, and federal funds. And as you all know, CCAP is paid through court order and federal funds. But programs like IDHS, home visiting, are still among several vital services without funding. As of today, it was released that $14.3 billion is what our backlog of bills has raised to. That's the highest it's ever been. And it jumped about $1 billion overnight or something crazy like that, just due to the amount of bills being submitted to be paid by departments. And even services with appropriations like education are struggling because of delayed payments. So the governor's proposed FY18 budget has increases for many early childhood services. And they're aligned with our requests, and they are necessary, but these critical investments can only be made if there's adequate revenue to pay for it. Like we're finding out with the education budget, even if you make the appropriation, if you don't have the money to pay for it, it doesn't really matter. So you can see here that the FY18 proposed budget from the governor includes about $548 million for child care, about $96.7 for early intervention, 16.9 for home visiting, and 443.7 for the early childhood block grant, and 102.1 for bilingual education. So just today, the Senate grand bargain, it might be up for a vote today. That's what we've been hearing, but it is yet to be seen. They might actually be taking that vote right now. But the Senate did introduce some appropriations today in Senate Bill 6, including some early childhood things, and they are lower appropriations than what the governor proposed in for the FY18 proposal, but they are still an increase from the last time they were actually appropriated. It gets a little confusing because FY17 estimated spending is a little bit over the last time they were actually appropriated, just because without an appropriation, sometimes we spent more than we thought we would. So there, like earlier mentioned, the $91.8 million looks like it's a cut from FY17, but it is an increase in the last time it was actually appropriated. So we're still doing some analysis on this because it's just this just popped out today, and Samir is down in Springfield trying to find out everything he can about this. But you can see on the right-hand column there, SB6, that is the introduced or proposed appropriations from the Senate today. Yeah. So, and we know that the House is also working on some budget things. They formed a working group to work with the governor's office on non-budget reform items, and they have laid out proposals in a press conference. I don't know the status of those conversations. I think everyone's kind of holding their breath to see what happens with the grand bargain. And I should say that even if the Senate passes the grand bargain, it remains it's yet to be seen if and how the House would change the bills that come out of that, and if that would if they would change it in a way that the governor would no longer sign. So for the final countdown, we have just like a couple weeks left of session and a lot to do in that time. So what to expect is that all the early childhood legislation should pass the Senate with every indication that they will pass. And the only bill we're slightly worried about is House Bill 3213. The governor has included the restoration for both this population, the non-TANF education and training, and the 162 to 185 federal poverty level. He's included both of those in his proposed budget, but he has not said either way if he will sign House Bill 3213. So we'll be looking out for that, but everything else we expect to be signed by the governor, and we'll continue to keep you all updated on continued budget negotiations, including if today there are votes taken on the Senate grand bargain. If little progress is made on the full budget, you will likely see a K-12 education appropriations bill like we've seen for the past couple of years. They have always still funded K-12, as well as a federal pass-through funding bill to make sure that even without a state budget, programs remain or continue to get their federal dollars. And I believe that that is all I have for state updates. I'm going to turn it over to Mercedes for federal updates, and then if you have any questions, make sure you write them in the chat box, and we'll answer them at the end of the webinar.
All right, thank you, Maria. So now as we transition to the federal side, I'm actually going to start off with budget and appropriations bills. So after a series of continuing resolutions, Congress was finally able to agree on and pass an appropriations bill for fiscal year 2017, and this fiscal year actually began on October 1st of last year. So the spending package contains a total of $1.18 trillion in spending, and about $5.5 billion of that is specifically for non-defense discretionary programs. So for early childhood programs, we received a $95 million increase for the Child Care and Development Block Grant, and that's a total of $2.9 billion. And technically, to implement all of the changes in the CCDBG reauthorization from 2014, we needed a lot more money. We needed something closer to $1.1 billion for fiscal year 2017, but we're actually going to take the $95 million increase as a small win because it's actually more than what was originally included in either the House or the Senate bills. For Head Start programs, there was an $85 million increase for a total of $9.3 billion, and that's mainly going to go towards cost of living increases, and $5 million of that will also go toward early Head Start partnerships. In terms of health and nutrition programs, $6.35 billion is going to go towards the Women, Infants, and Children program, which is also known as WIC, and so that program is being flat funded. For child nutrition programs, there's a $644 million increase for a total of $22.8 billion. And finally, for the Supplemental Nutrition Assistance Program, which is also known as SNAP, there's actually a $2.4 billion cut to the program. So funding for SNAP is going to be $78.5 billion total for this fiscal year. The 21st Century Community Learning Center program will have a $25 million increase for a total of $1.19 billion. And this program funds learning centers that provide more opportunities for kids, so specifically for kids attending high poverty or low performing schools. The preschool development grants are also going to be flat funded at $250 million, and the Department of Education is going to see a $1.2 billion cut from the previous year, So the Individuals with Disabilities Education Act, which is also known as IDEA, Parts B and C are going to be flat funded this year. So for Part B, which is specifically for kids aged 3 to 21, they're going to receive $368 million for that program, and Part C, which is for kids aged birth to 2, they will receive $459 million. And so fiscal year 2017 is set to end on September 30th, which means that negotiations on a spending bill for fiscal year 2018 actually need to begin soon. And the president laid out his priorities in March, but we should see a more detailed proposal coming out soon. Based on the details that we received from the administration's skinny budget, which came out in March, the president's spending priorities for the next fiscal year, we have a little bit of an idea of what they look like. So overall, the administration's skinny budget didn't really go in depth into programs, but from what we know and for the purposes of our work, he would like to cut the Department of Education's budget and the Department of Health and Human Services budget quite severely. So the Department of Education is actually, he wants to see their budget cut by 13%. In order to do that, so there would actually be a $1 billion increase in funds for Title I schools. They wanted to flat fund IDEA, but they would eliminate the 21st Century Community Learning Center programs. And so they just don't believe that this program is effective for kids, so they just decided to gut it completely. And for the Health and Human Services budget, the administration proposed giving it a 17.9% cut. And in order to partially achieve that goal, they want to completely eliminate 2 programs. One of them is the Low Income Home Energy Assistance Program, LIHEAP, and the Community Services Block Grant. And that is actually an anti-poverty program that coordinates services to be delivered to low-income individuals. So I just wanted to emphasize this is actually only the president's proposal. It's not actually how those 2 departments are going to be funded in the upcoming fiscal year. Congress still has to negotiate those spending bills in the coming months. All right, so moving on to the American Health Care Act, Republican leaders of the House of Representatives introduced the American Health Care Act in March to repeal and replace the Affordable Care Act, which is also known as Obamacare. They were basically working on finalizing the bill for the AHCA at the same time as they were working on finalizing an appropriations bill for fiscal year 2017. However, Democrats actually threatened that they wouldn't vote for the spending bill if Republicans tried to cram through a vote on the AHCA too quickly. And so in order to not compromise the original spending deal, it was voted on first, and then the AHCA vote came about a week later. So on May 4th, Republican leadership was finally able to gather the appropriate number of votes to pass the bill, and it passed the House with a vote of 217 to 213. And since this healthcare bill is pretty convoluted, I'm actually only going to go over some of the main parts. So one of the main parts is that it repeals the individual mandate. Under Obamacare, individuals had the option, well, they basically had to purchase health insurance or pay a fine. So this bill would get rid of that provision. But if an individual allowed their health coverage to lapse and all of a sudden they decided that they wanted to regain health coverage again, they basically had a 63-day limit to re-enroll in a plan. After those 63 days, individuals would be charged 30% more on their premiums for an entire year. So although the AHCA would roll back the individual mandate, there would still be some type of penalty involved in disenrolling and then trying to re-enroll in healthcare. Secondly, the AHCA also replaces subsidies with tax credits, and I'll go over this a little bit more detail in a minute. Medicaid is also going to be restructured in this bill, and states have the opportunity to request 2 waivers from Obamacare policies, which are the essential health benefits and community rating. All right, so one of the biggest changes that the AHCA would make is to repeal the subsidies that Obamacare offered. So Obamacare offered subsidies to enrollees based on their income, so they would be available to families that made less than 400% of the federal poverty level. And these subsidies would basically just help families pay for a health insurance plan just to make it more affordable for them. States also had the option of expanding Medicaid for its residents. for residents that made under 138% of the federal poverty level. And 31 states decided to do this, including Illinois. And so nationwide, this actually expanded coverage to 11 million low-income individuals. But going back to the subsidies, under the AHCA, individuals would receive a tax credit based on their age and not necessarily based on their level of need. So for most people, the tax credits are actually going to provide a lot less assistance than the Obamacare subsidies. And it's being estimated that the average individual that purchases insurance through the marketplace is going to see their premiums rise by about $2,400, and deductibles and co-payments are also likely to rise. So Republicans are also proposing a pretty big overhaul to the Medicaid program, which mainly serves low-income children, families, and the elderly. And so the AHCA includes an $839 billion cut to Medicaid over a 10-year period, which would be about a 24% cut to the program. And so they are providing states with a few possible options in order to reduce Medicaid spending. And states would basically just have to pick one. And so the first option is actually to change Medicaid from an entitlement program. And in an entitlement program, everyone who is eligible for services qualifies. So the AHCA proposes to change Medicaid from an entitlement program to a block grant program. And a block grant program would give states some more flexibility in how they structure and administer the Medicaid program. But if the program is block granted, it's basically just a way to cut spending and also cut services. So states would have a fixed amount of money to spend on the Medicaid eligible population. And Congress really doesn't allocate enough funding to block grant programs. It actually stays pretty flat from year to year. So states are likely to have to create wait lists or to only cover a specific set of services instead of serving everyone who's eligible for Medicaid. The second option is to create a per capita cap. So states would be given a specific amount of funds for each Medicaid enrollee, and if that patient actually ends up needing more services than anticipated, then they'd basically be out of luck because the program wouldn't be able to cover it due to the cap. The third would be to impose work requirements on adults who aren't elderly, disabled, or pregnant. But to be clear, the majority of adults on Medicaid are actually working. So those are the three options for states. And lastly, the GOP also wants to freeze expansion enrollment, so those who are making under 130% of FPL. So to go a little bit more in depth into what would happen if Medicaid structure was changed from an entitlement program to a block grant program or to a per capita cap. So currently the federal government reimburses states a fixed percentage of their Medicaid population services, and so that reimbursement percentage tends to be from 50 to 75%. For Illinois, it's closer to 50%, and for states who have lower incomes, then it's going to be higher to the 75% reimbursement rate. So in general, the federal government takes on the bulk of the cost for the Medicaid program. But under a block grant or a per capita cap, because funds would be limited, states are actually probably going to have to do one of the following. So one would be to lower provider reimbursement rates, which could cause fewer providers to accept Medicaid patients. Two is that states may have to cap the number of Medicaid enrollees that they provide services for and create a wait list. And three would be to limit the types of health services that are going to be covered for each enrollee. And so one of the most important things to remember is that by changing Medicaid structure, we're actually going to eliminate the program's the program's ability to respond to need as is necessary. And so that's actually one of the most important parts of Medicaid, that everyone who is eligible for services receives services. So now I'm going to transition to the MacArthur-Meadows amendment, which is one of the amendments that technically saved the AHCA in the House of Representatives. So under the MacArthur-Meadows amendment, states would actually have the option to apply for 2 waivers. But if they were to apply for these waivers, they would basically be automatically granted because there's really no review process that has been established by the feds. So the first waiver is essential health benefits. And under Obamacare, all health insurance plans had to cover these 10 essential health benefits, and I'll actually go over them on the next slide. The second waiver is community rating. So it used to be that companies would charge you a rate based on your personal medical history. And so Obamacare changed that. So instead of it being based on an individual's personal medical history, it became more of a community rating. So it made health insurance more affordable for a lot of people with pre-existing conditions. And so a waiver for community rating is actually really dangerous because insurers would be able to basically deny coverage based on medical history, impose annual or lifetime limits, or eliminate coverage for specific services in their plans. It has been stated that the AHCA would not allow insurance companies to deny coverage or charge much higher fees based on pre-existing conditions, but essentially this is false because in waiving the community rating requirement, companies will charge people based on their individual health plans, based on their individual health, and the plans offered to them may not cover the services they need at an affordable price. If a state does apply for the community rating waiver, then they have to have some type of program in place to help people with pre-existing conditions find affordable health care. And so one of the examples for this would be the creation of a high-risk pool. But these pools tend to have limited funds available to help people afford their premiums. And for high-risk pools, people with pre-existing conditions are pooled with people who are even sicker. So that just means health insurance for basically everyone with pre-existing condition will rise. All right, so for the essential health benefits, these are the 10 essential health benefits that that Obamacare forced insurance plans to cover, and they could actually be done away with completely in the MacArthur-Meadows Amendment. So the benefits include prescription drugs, emergency services, preventative care services, basically things that we tend to see as basic services within the healthcare industry. And so if a state were to apply for this waiver, health insurance companies would no longer have to offer these key services in their plans. And one more thing that Obamacare prohibited insurance companies from doing was imposing annual or lifetime limits on this list of 10 benefits. And so that would actually also be changed under the amendment. So due to Obamacare, we actually have the lowest uninsured rate that we've ever experienced because health insurance has just been made more available and more affordable to individuals. So the Center for Disease Control actually reported that 9% of Americans were uninsured in 2016. And since Obamacare has been passed, about 20 million Americans have actually gained coverage. However, due to the structured changes proposed by the AHCA, the Congressional Budget Office's analysis on the earliest version of the AHCA stated that over the next few years, the uninsured rate is actually going to start rising again. So by 2026, we're actually going to see that 24 million Americans will no longer have access to health insurance. So I quickly wanted to rehash some of the possible effects under the AHCA if it does pass through the Senate as is, but at this rate, it's actually pretty unlikely. So over the next 10 years, about 24 million people are expected to lose their health coverage. Medicaid would be cut by $839 billion, and specifically only from changes to the Medicaid program, that means that 14 million fewer people would have coverage. And overall, individuals who purchase insurance through the marketplace are probably going to have to pay more for less services. I also wanted to show this figure which details how much children benefit from Medicaid in Illinois' All Kids program. And so the All Kids program is actually funded through the Children's Health Insurance Program, which is federally funded, and it's also known as CHIP. So in Illinois, All Kids serves kids whose families earn slightly higher incomes than what would allow them to be eligible for Medicaid. So it's still serving low-income children. But based on this figure, we see that Medicaid and All Kids serve 84% of children living in or near poverty, 45% of infants, toddlers, and preschoolers, 42% of kids with disabilities or other special needs, 100% of kids in the foster care system, and 50% of all newborn families. And so CHIP is actually going to be up for reauthorization this year. And And so I just wanted to detail how crucial this program is for young children and their families. So in terms of what to expect next at the federal level in the coming months, the first one is the AHCA. So it's currently in the Senate awaiting consideration. The Senate has said that they're basically going to wait for final analysis by the Congressional Budget Office before voting on this bill. But senators have also begun working on their own version of healthcare reform. So it really remains to be seen how much it will differ from the AHCA itself. The second thing to expect is fiscal year 18 budget negotiations are also going to begin soon, since the next fiscal year begins in October. Republicans are also attempting to do tax reform, and within it seems like the Trump administration will detail out some more of its child care tax plan a little bit better. Not a lot of details have been released, so we hope that will come rather soon. And lastly, there are a few programs up for reauthorization. So there's McV, which is a maternal, infant, and early childhood home visiting program, and CHIP, the Children's Health Insurance Program. So it's important to keep your congressional representatives and senators engaged, just to let them know how crucial both of these programs are to young children and their families. All right, so now we would like to take time for questions. So if you have any questions, please be sure to type them in the chat box. We have a few upcoming events. So we're going to be conducting the same policy webinar, but in Spanish on May 22nd. We also have the Partner Plan Act Conference coming up on June 13th in Bloomington, and the statewide Public Policy Caucus, which is on June 22nd in Normal. So we're just going to give you a few moments to type in your questions, and then we'd be more than happy to answer them.
Hi, okay, so we just got a question, says how will block grants be distributed if we still don't have a state budget? And I believe that, you know, if that were to happen, if block grants were to be implemented for Medicaid, through federal pass-through funds, you know, we've passed those bills every year. I think it would be along the same lines, because right now, you know, the child care federal dollars are actually a block grant, and we continue to get those because of the federal pass-through bills that have been passed the past couple of years.
So it seems like that's actually the only question that we have, but just in case any of you think of questions later on, you're more than welcome to email Maria or I, and we have our both of our emails up on the screen. So once again, thank you so much for joining, and if you have any questions, feel free to email us, and have a good rest of your day.